Hello, my name is Marion. In this review, we are going to talk about procedures, but this time we are going to talk about the neck. In the last presentation, we talked about the head. For our neck, we are going to cover the soft tissue of the neck, your larynx, your contrast media that is going to be used if the patient is not allergic, and special procedures. For the CT registry review, this is just an information about it, just in case you forgot. It is going to have 165 questions on it, but you also have those 30 unscored questions. So it'll be over 200 questions on the registry. We have already talked about patient care and patient safety. I will talk about image production in another slide or another video. But for now, we are learning about procedures. We did the head last presentation. This time we're going to talk about the neck. For your soft tissue neck, know that this is a sagittal image. You want to make sure that you know your imaging planes, meaning you need to know how an axial, coronal, or sagittal image looks for your CT test, or just in general how it looks whenever you are doing your scan. And whenever I do a soft tissue neck, I normally scan from the top of the frontal sinuses all the way down to the aortic arc. I always make sure that I'm getting the tip of the nose in there. This is just an image just for educational purposes that I found online. But normally I just get the frontal sinus all the way down to the aortic arc. And whenever you do have your patient, just tell them to hold still on the table and make sure that they are relaxed, because if they are swallowing, it's going to cause motion in that area where their neck is at. The clinical indication for a CT soft tissue neck, it will be inflammation or swollen glands, if they have an infection or abscess, any type of cancer, if they have trauma to that area. So whenever things like this are ordered, most of the time the doctor will probably order it with contrast. But if the patient is allergic or for whatever reason cannot tolerate contrast because of their kidneys, then it will be done as a without contrast study. This is an image of your larynx. Have the patient lie supine on their back. Just tell them to hold their breath to avoid motion. And just in case you forgot, your larynx is the voice box. It's going to help protect your airway, produce sound, and help with breathing and swallowing. For your CTA or CT Necks, whenever contrast is indicated, it can be to see those lymph nodes, those tumors better. And I always start with the pre-contrast image first. This will vary by your protocol, but it is best to start with images without contrast so that you can get a good image of how your neck looks or how the patient's neck looks before contrast is given, and then you give the patient contrast. It will come with a scan delay time anywhere from 30 to 60 seconds, depending on how your protocol is set up, what the radiologists prefer. You have your contrast ranges from 50 to 150 milliliters. If I have an IV in the hand, then I am going to inject at 1.5. But if I have an IV in the AC, then I can go to 2. You can go up to 3. But for your CT Necks, since this is not an angiography study, you can have an IV in the hand. It doesn't hurt to have an IV in the hand for this study. Now we are going to talk about your CTA. Whenever you are doing this, you want to make sure that you have either an 18 gauge or a 20 gauge in the AC or forearm. You cannot have the IV in the hand or the wrist because you do have to inject the contrast at a faster rate, in between 3 to 4 milliliters per second. So you want to make sure that you have a good IV. Textbook wise, it is saying to start the IV on the right arm. This is going to avoid streaking. However, if the patient does not have a good vein in the right arm, then start it in the left arm. Start it wherever you can get it. I have started an IV in either arm. So sometimes you cannot always get an IV in the right arm. Of course, it's going to help give you better images, but you can't stick a patient 6, 8 times in their right arm to get a good vein. You will need to go to the left side because you can't go in the hand. So avoid the hand and wrist. Make sure you are doing your 3D images, your MIPing, and your MPR reconstruction per your facility's protocol. You want to make sure that you know your anatomy. This is a good illustration for you. Even if you are a technologist, you want to make sure that you are covering the right anatomy, the right scan range. So use this as a guide to help you study, okay? Another image of the CTA neck, you want to administer anywhere from 50 to 75 milliliters of contrast. You can also administer based off a patient's weight and if they have kidney problems or not. So just check with your facility's protocol about that. I have given 100 milliliters of contrast depending on their body size. I've given 70, I've given 80. So it's just going to vary. So just go by your facility's protocol. If they go weight based or kidney function, just go by that. Well, this was a short presentation. We just covered the neck in this video. In the next slide or lesson, we are going to talk about the chest. The chest have a lot of interesting things involved in it, a lot of anatomy and procedure. So we will talk about that in the next lesson, and I hope you all enjoyed this presentation. Thank you all for watching.